It is often said that a healthy nation is a happy nation. And with that, I'm very excited to be here at First Mutual Park with First Mutual Health, where they're excited to be launching a new product, hospital and emergencies only plan. And with me today are some executives from First Mutual Health, with me being
Anyara Limet Atasranabu, General Manager.
Joseph Nago, the Senior Sales Consultant.
Daniel Chpangura, the New Business Development Manager.
Thank you all. Starting with you, Nyaratai, would you give us a brief insight into what really is this project? What is your new offering to the market?
Thanks, Kudzai, for that question. We are excited to be launching the Hospital and Emergency Only Plan, which is our new health insurance product that's no frills and budget friendly, designed specifically for our clients who only want essential hospital cover without the added cost of paying for extras that they don't need. We identified a gap in the market where individuals may not necessarily be able to afford the comprehensive medical aid, but still face the crippling financial costs associated with hospitalization. So that's where we come in. Our product aims to cover the hospitalization costs associated with any bout of hospitalization, regardless of whether it's caused by accident, illness, and even maternity.
Thank you, Nyaradzai. It certainly sounds like a product that has been developed with the market in mind. And with that, Daniel, please can you give us some insights as to what really influenced the development of this product?
Thank you for that. So the Hospital and Emergencies Only Plan was developed from market feedback that we are getting and also the research that we've done as a business into the needs of our particular markets. So what we've identified is that no matter where individuals are in the SME sector, in the diaspora, in the corporate world, they actually have certain needs that needs to be met. And particularly people in the diaspora, they do have their relatives back home that they need to be covered when they are hospitalized. And those bills are quite huge in most instances, and this product is there to plug that gap.
Thank you, Daniel. Indeed, we can see that this product is people-centered. And over to you, Joseph. May you please give us an outline of the services that those who sign up can enjoy while on this plan?
Like the GM said earlier on, when a member is hospitalized or when someone is hospitalized, there are crippling financial costs that come about with admission in hospital. So when you're hospitalized, you've got things that need to be covered, like your medication that is administered, your x-rays or your scans that are done in the event maybe you're in hospital due to a RTA. You've got things to do with blood tests, your pathology, where you need to have this done, test done by a laboratory. So these are some of the core benefits that the product covers when you're in an inpatient or when you're hospitalized. And there's also the issues to do with specialist consultation and procedures. If you need a procedure to be done, if you need consultation by a specialist, these things are covered by the product when you're hospitalized.
Quite comprehensive. To you, Nyaradzai, as far as women are concerned, what about maternity, pregnancy, any of those hospitalizations?
And definitely we are covering maternity care. Our product is specifically designed to cover that. So be it your normal delivery, cesarean sections, we are covering hospitalization associated with that. Of course, our standard waiting periods will apply.
Indeed, it is very clear that this is a very inclusive product. Joseph, what makes this plan different from all the other plans that are currently on the market?
So first and foremost, like we said, the core benefit is hospitalization. But over and above that, we then have value-added benefits that come through with the product. Where a member is admitted in hospital, we do have what we're calling the hospital cash back, which kicks in the third day of admission. And this product is underwritten by our sister company, Nichols Diamond. So what we're simply saying is that on the third day of admission, if you need cash, to cater for any home expenses that have been hindered due to your hospitalization. There's a cash payout that will come through. Then we've also got wellness. We believe prevention is better than cure. So before you even go to a hospital, there are wellness programs that happen at First Mutual Health. So members can definitely then also look to enjoy some of those products. Then last but not least, we've got what we're calling the funeral cashback. In the event that a member has unfortunately passed away, there is funeral cover that comes through. It's as little as $500 per dependent. So this is a benefit that is underwritten by our sister company, First Mutual Life.
These are very exciting and interesting as well as useful value ends. Thank you very much for that. In terms of the different packages available, please can you outline the different packages that you've got and the targets for each?
So we do have 3 plans essentially. 2 are corporate plans and 1 is an individual plan. So we've got the hospital access, which is our corporate plan, which goes for $20. That's the entry price. Then we've got the hospital prestige, which is the second corporate plan. Then thereafter we've got the Garnet Hospital, which is our individual product, which is going for $46 an adult. So you'll find that in our line of business, it's all about numbers. So we are encouraging members to come through. If you want to enjoy the discounted corporate rates, you need to come through as an organized group with a minimum of 10 employees or 10 family members. Then we can give you the corporate plans. You choose between the 2 corporate plans. Whereas if you're an individual, if you walk through our offices, you then have to apply for the individual plan.
All right. So clearly I'm hearing that isu them around, we can get to benefits from these exciting discounts should we have these organized groups as well as churches and any other associations.
Correct.
Thank you very much for that. It definitely sounds exciting for those with organized groups. Nyarazai, we spoke about accessibility. Please can you tell us more about how accessible the services will be for anyone who joins this plan?
Accessibility is the cornerstone of our product. So for the hospital and emergency only plan, we have come up with a preferred provider network, which is a partnership with the leading hospitals in this country. So a person can get cover from anywhere within Zimbabwe, regardless of how inaccessible that area is, whether it's in Binga, Buhera, or even Cholochode.
That's interesting. From Chegutu, from Wonde to Haona, Mefiwe accessible. Okay. And as we would encourage people to sign up, Daniel, can you tell us how someone who wants to sign on can get on this plan?
Okay, so we do have numbers that I show you on the screen. And if you just SMS or WhatsApp that number, which is the WhatsApp Health, our call center teams will reach out to you and help you with the onboarding process.
Exciting news. Joseph, please let us know if there are any upcoming promotional activities that the viewers would be excited to take part in.
We've got physical market engagements, programs that will be rolled out. We've got online competitions, promotions that will be coming through. So we encourage people to follow our social media pages. Please do. And look out for these activities. We want to engage you as much as possible. And let's have fun.
Any last words, Nyarazai?
Thank you, Kudzai, for the discussion. Certainly, I do have a last word. Our strategic focus remains the financial inclusion of everybody in Zimbabwe, and that is exactly what we are aiming to do with this product. And we can assure our prospective clients that if they join us, they are going to enjoy a high quality service and enjoy a peace of mind that comes from knowing that their hospital costs are covered.
Exciting. Daniel, any last words?
Okay, just to say the product is here. Everyone please come and join. We are ready to cover your health. Your health is our concern, and we'll do it with the quality that we've been doing over the years.
Indeed, quality and inclusive healthcare is at the core of First Mutual Health. And with that, we encourage you to follow their social media handles where you learn more about the hospital and emergencies only plan.